Hi, my name is Leah. Sorry I'm a little bit late to the game. I've been a little bit sick, um, but I wanted to talk about the three major facets of my nursing practice. So I took a little bit of time to think about this, and the three major things that I think about that guide my practice in nursing are equality, patience, and autonomy. Um, so I'll go through those, and I think they're all linked to some life experiences and professional experiences that I've had. So first, equality. I grew up in West Virginia. There's lots of poverty there. It's a very community-oriented environment, and I started to do community service. We didn't even call it community service, but started to do community service through my church, a Presbyterian church. Um, and then eventually in high school, I went to a Catholic high school, and community service was required for us to graduate. And also, we served in the Appalachian Service Project, which is kind of like Habitat for Humanity, but it's based only in the Appalachians, only in West Virginia, actually. And you help build homes or fix homes for people that are in need. Sorry, I have a cat. Um, and then after high school, I served in AmeriCorps, and I worked in a domestic violence shelter in a rural area of Northern California. And I met lots of people that were completely different from anyone I'd met before there. And that also helped me learn how to work with different people and be more open minded with lots of different ways of living, and understand that people may not be the same skin color and all that as I am, but we may disagree on many things, but we can agree to disagree. And I feel like that is translated in how I work with my patients. Um, so And then on to autonomy. Um, so my first job after AmeriCorps, I worked in a teen parenting, pregnancy and parenting program as a case manager. This was before I was a nurse. So I helped oversee the medical and educational services for the infants and toddlers for teenage parents. So this position was amazing because I got to learn a lot from my clients. I was pretty young myself. I was like 25. So I learned a lot about uh, parenting firsthand, and I got to form really great relationships with my clients and see many of them turn into functional, mature families. So that was great. But the position was also frustrating because teen parents aren't always on time for their appointments. They like to go out, and they're kids still. So I sometimes found myself over managing them, not allowing them to fail occasionally, um, and uh, this taught me the important value of autonomy. So I think this directly translates to our job as nurses, because our job as nurses is not to direct the patient's care. It is in a way, but it's also to help the patient direct their own care, help them manage their own care. Um, and this is especially important in, sorry, I'm losing my cards here. This is especially important in oncology because you have to make sure that the patient is continuing treatment because that's what they want to do. A lot of times patients will uh, keep on going with chemo, sometimes really tough regimens of chemo or radiation or what have you, because they don't want to let their families down, or they don't want to let their provider down, or their nursing team down. And so we have to make sure that they know that they're not letting anyone down, and it's our job to help them make those decisions and stand by those decisions. So yeah, so autonomy is important. Um, and then lastly, and the last value or virtue that I'm learning to help guide my practice, I'm still working on this one, is patience. Um, so I work in an infusion clinic, and mainly chemotherapy infusion clinic, and it's very busy, and there can be pressure to move patients through their treatments really quickly, not really quickly, but efficiently, so that other patients don't need to wait to get their treatments. So most of the time that's fine, but sometimes a patient just needs you to sit with them for some extra time. Um, they may not even need to talk, they just need to have you there with them, have your presence. So I'm learning how to sit in emotional and sometimes uncomfortable moments and resist the urge to fill that silence with finding a solution to their problems or um, offering encouragement, because sometimes all they need is just you to sit there with them. Um, so, yeah, that is all I had to say today. Sorry for my sniffles, and thanks for listening to my video.